Alliance Medical Training Center here in Gainesville, Florida. And I am a registered nurse. Started off as a CNA, became an LPN in 2003, and a registered nurse in 2017. And I have worked in all type of settings, including a director of nursing in assisted living, on and off for a few years. Okay, so I have lots of experience in the assisted living setting. And so today's video is about what is a MedTech, and what's required to be a MedTech, and just a couple of tips and tricks about being a MedTech, and if you're a new MedTech or interested in, going down, taking that journey. So let's talk about what a MedTech is. Now, keep in mind that there is a certified medication technician program that is a degree program, but that is not this program. So I get called sometime about that course, but that's a degree program. Okay, let's talk about this particular program, which is a 6-hour training. This course is this actual training here. Okay, so the course is assistance with self-administration of medication administration. Okay, assistance with self-administration of medications. Let's talk about it. So this is approved through the state of Florida. The reason why I want to talk about why you're able to give meds in this setting and what's required for you to do that. Okay, so first thing first is that you are required to take a 6-hour training and that could be taught by a registered nurse, a LPN, or a pharmacist. Okay, those are the people that can teach that course in the state of Florida. RN, an LPN, or a pharmacist can teach this course. Okay, so that's a 6-hour training, and it's approved through the state of Florida and Governor DeSantis. And also on top of that, it's required that you also have what's called the patients, and I call residents in assisted living settings, have to, or their caregivers, or their whoever signs for them, has to sign what's called an informed consent. So that's required. So those are the things that is needed. 6-hour training. You have to take and pass an exam, and then you will be officially certified to assist with the self-administration of meds. Okay, and so those are the things that's necessary to be put in place. Okay. Now, let's talk about what a MedTech is. Because some people, I think they think that when they become a MedTech, that's all they're going to do as a MedTech, okay? But it's more than just doing a MedTech, okay? You have to understand that in assisted living, they pretty much in those roles, they hire either a resident, you are either a resident aide, and that could be a different title. Understand that for the most part, you'll be directly responsible for the care of the residents, okay? You wouldn't be assisting with meds or any of those things. You'll pretty much come in, get them cleaned up, do their baths, get them ready, take them to meals, all the things, make sure they do activities, all those things, okay? So you would be pretty much a resident aide. A MedTech was somebody who also does all these things and do meds, okay? So just understand that you will be doing a dual role, okay? Hopefully that includes more money, because I would hope if whatever setting you're in, you should be getting more money. So typically you should be getting more money, but understand that you also will be getting less. Typically you should have less patients, okay? So where the resident aide will have probably 15 patients, you possibly should have 10. I'm just giving out some numbers, because you're going to also have meds to give, which you're going to have to account for, okay? So meds take up a big chunk of your time, so it's important that you don't be bombarded with a bunch of residents, because you got to be able to focus on meds, which can cause huge errors if you're not careful. So you shouldn't be taking on the same equivalent load as the resident aide, okay? Understand? Hopefully that is the situation you're in, okay? Now, so basically let's talk about, so the informed consent I mentioned just a bit ago. The informed consent is important because what that does tell the family member is that they know you took a 6-hour training, that you're not a nurse, and I'm okay with that. So they sign that. That is usually updated every year, that they sign an informed consent, okay? So that's what's required for you to become a MedTech. So it also is really beneficial to you if you could go to an interview with that already in hand, because one thing they are in need of is MedTechs, okay? Because they don't want to hire nurses if they can help it. MedTechs are super beneficial, and it costs less money as well. But also that they want, if you go to the interview, if you already have your MedTech, get your certified MedTech, then you can go to the interview. You got a better chance of getting hired, because they definitely want a MedTech over a resident aide, okay? Because basically you're going to be doing MedTech and resident aide, so you're going to be a double whammy, and they are going to be really grateful for somebody like you that's going to take this certified MedTech training and come to the door with it, okay? So it's definitely some perks to going ahead and getting your MedTech in advance, okay? Understand that if you are hired in most settings in the ALF already as a resident aide, most of the time the director in that role is, or she'll have somebody, for some most part the director is also somebody who teaches that course in her role there. And so usually if you're already working in that setting, they'll pretty much allow you to they'll put you through the training on site, so you don't have to really go outside to get your MedTech training. But if you somebody who's just trying to get into a job setting, then that would be definitely beneficial to you to go ahead and get that MedTech training before. Okay, 6-hour training. Okay, so let's talk about what exactly what you can do and shouldn't be doing in a MedTech role in the state of Florida. Let's talk about what you shouldn't do, because those are the most important things, that you understand the scope of practice and what you should and shouldn't be doing in that role. Okay, so there's some things that are significant. Like, for one, you wouldn't be doing anybody with blood sugars and diabetics. That's diabetics, right? You should not be assisting with medications that require injections at all. That is outside of your scope. Okay, you shouldn't be checking blood sugars. It's not part of a MedTech's role in Florida. Okay, understand that. Some people confuse the fact that if they're a CNA in a hospital setting, CNAs do check. So yeah, in the hospital setting, they are doing blood sugars, but understand that in ALF, you should not be doing blood sugars, okay? You should not be doing nebulizer treatments. Nebulizers is a machine that's used for breathing, that it helps inflate, for people who have like asthma attacks or COPD, things that's causing them to have a hard time breathing. Those are machines that you put some medication in and it put it on your mask, put the mask on your face. Even though that seems pretty simple in the state of Florida, you are not allowed to assist with a nebulizer treatment. You should not be doing nebulizer. That is outside of your scope in Florida, okay? You should not be doing dressing changes in the state of Florida. Dressing changes should be done by a nurse. Now, what you can do is first aid. So if that resident happened to get a cut on them and they started bleeding, you can you can take care of it, clean it up, put something over it. The problem is the next day you can't treat it. That is a wound care at that point, and that requires a nurse, okay? So it's just a few important things that you need to know that you can't do. You can do a lot of other things, though. So you'll be given narcotics. You're going to be given crushing meds. You're going to be, so I'm going to do a video. I'm going to do a follow-up video to this on how to properly do a med pass and the things that you should make sure are in place. So stay tuned, because I do post a lot of videos about these. Even in my medical assistant course, phlebotomy course, I talk about different things, but I want to focus on MedTech, because I can't find a lot of information on YouTube about MedTechs, and I know it's a lot of people that's interested in MedTech courses, okay? So I want to focus on that just for this month is my goal. This the next few weeks is I'm going to do some videos talking about roles as an MA and what you should and can and can't do, and the correct way to assist with medication, because you cannot administer meds. So I want you to understand that in your role, you are doing medication observation record. This is a medication observation record, which is a more, and I'll go in depth with that a little better on another video. But that means that you can't administer meds. So I'm a nurse, I can administer medications. The difference between observation and administration of meds is you can observe them take a medicine, and I can administer as a nurse. So you got to keep in mind that you should never, I'm going to take that back, you should never be putting the medicine in the resident's mouth, okay? What you can do is what's called hand over hand. This will be the resident's hand, and you can assist them with their meds to their mouth. That is the expectation of a med tech in the state of Florida, okay? You will be assisting with medications in that manner, okay? Now keep in mind, you're going to see some stuff that is way more than what I'm telling you, but understand, once you know the scope of practice and you know what your role is, what you choose to do outside of your role is your choice. But I'm just telling you what you are allowed to do and what you are not allowed to do in the state of Florida, okay? So there's a lot you can't do. Like I said, you're going to be doing narcotics. I'm going to talk about in some coming videos about controls. I'm going to use one video just to focus on narcotics and how to. Okay, a couple more things that I'm going to tell you in this video is that, because I want to try to keep this a little short, is medications. When you're preparing medications for residents in assisted living, you need to understand that part of how you still are allowed to give meds is that you do that in front of the resident. You should not be, and you're going to see differently, I'm telling you, but the medication should be pulled, taken out of the cart, prepared, and given to the resident in front of the resident. The resident should be present. Everything that you're doing for that resident, you should do with the resident present. You should never be preparing those meds to take them to the room, like to have a cup full of meds and walk the med to the resident's room. That's called pre-pouring that medication. And And understand that people are doing that, but understand that mistakes happen, errors happen, and people can accidentally die as a result. And that's dramatic, but I'm being serious. Like, you need to follow policy when you're doing those meds. So you need to prepare those meds and do all the things with the resident present in front of you. That is how you're able to give those meds. And I understand and realize we have a lot of it going on. We have 15 patients, we got dinner to do, we got showers to give. But I'm just telling you that there are some shortcuts you shouldn't take, and if you take those shortcuts, you just have to own the results if it costs somebody their life, okay? So if you got to go to the resident's room to do their meds, just take, I tell them to have a little caddy thing that you use like in the shower. Take that, put your MAR in there, put your meds in there, and take that to the room if you don't want to push your whole cart to the room, okay? So just keep in mind that we really should not be preparing those, we should not. Florida says that you should not be preparing those meds unless that resident is sitting in front of you, okay? So that's important that you always remember, and that the most important thing that I want to end this video with is that when you're done giving the meds, you have to document. That is what they care about the most. Now, I need you to know document means you're going to sign that you gave the med, that you saw them take the med, and that you saw them swallow the med, and then you document it, okay? So we'll do a couple things real quick. I'm just going to do a little rundown. So certified MedTech in the state of Florida, 6-hour training, and then the family, and once you're hired, they will inform consent will be on file that they are okay that you're not a nurse, okay? Then you want to make sure that you pull the meds in front of the resident. You want to make sure you know that that is the right resident. There's some things that you need to know about and making sure it's the right medicine, the right drug, the right time. The medication times are 10 a.m. and 10 p.m. You have a 2-hour window. You can give that med an hour before and an hour after. You need to be really careful and just making sure they swallow the pills. You don't want to leave those meds at the bedside. They could choke on those pills. Somebody else could walk in and take those pills by mistake. I know an incident where a little kid took a couple of pills that belonged to the resident because the MedTech left the pills at the bedside. Not that she came to work to kill anybody or try to hurt anybody. She was in a rush trying to get through her day because of all the things that she has to do. But at the end of the day, we want to be careful when it comes down to meds, okay? Okay, and then lastly, the Certified MedTech certification, when you receive it, that is good for 1 year. It's annually updated. So within a year, it's scheduled to be updated again. You do a 2-hour update. So basically, it's a 6-hour training initially, and then there's a 2-hour update that's required every year. If you let that time pass before you get it updated, you will be taking that 6-hour training again, okay? So keep in mind that that is only good for 1 year. It's a 2-hour update required before it expires, okay? You need to do that because I don't think you want to come and go through a whole 6-hour training again and pay that fee again to be able to have that updated. So yeah, hopefully this video has been helpful. I'm going to come back with a couple of videos. One's going to be focused on narcotics and how to avoid getting caught up in narcotics and about properly, correctly doing the meds. So I'm going to spend some time one day on a video where I can show you how to properly pull those meds and administer those meds and how to do it safely, okay? So I hope this has been really helpful to you. Certified MedTech is an awesome opportunity, especially if you're somebody looking forward to maybe moving forward into becoming a nurse and want to get some medication experience, because you'll be doing all the things with medication, so many things, and you can learn a lot from it. So I think it would be a good opportunity for a lot of people, even if you just want to make it as a career. MedTechs are is very high demand. Assisted livings is growing by the numbers, just not going anywhere. Even here in town, we've grown with the number of assisted livings that we have in town. So it's definitely something that you definitely want to look into if you're interested in and love taking care of people. Because first thing first is I hope you love taking care of people, because this is definitely not a job that you should be. I know we got to pay bills, but you got to care about these people. So if you're moving forward and want to take care of people and want to be helpful and just do all the great things that you could do and just learn about these residents, because they have so much to share with us. These people are so amazing, hearing their life stories. Then definitely look into a Certified MedTech, and I do offer that class here in Gainesville, Florida. But if you could take that anywhere, and it's not offered online. I have people asking me about an online version of Certified MedTech. I don't know how somebody could do Certified MedTech online, because you need to be able to know how to do the meds and all the things like that. So I don't know, but I don't offer that online at this time. I'm sure I won't be offering it online, but I am here in Gainesville. But if you could find a good, reliable, Certified MedTech training school, then I think it would be definitely beneficial. So yeah, stay tuned. I'll be posting more videos. Again, I'm Erica, owner of Love Reigns. I love what I do, and I appreciate you stopping by to check out this video.